Rehabilitation programs have been around for some time now, but there is new research from health officials in Wales that shows patients who participated in a prehabilitation program there spent on average 3 fewer days in the hospital.
Joining us now is Dr. Amar Rivari. He's a radiation oncologist and adjunct assistant professor at Johns Hopkins University. Doctor, great to have you with us again. So this report that we were just referencing in Wales acknowledged its limitations in the findings, as the majority of patients had one type of cancer, so they were really zeroing in on just one experience. There was also some concern about the lack of diversity, ethnic minority communities not being as included in their study. With all that said, how can prehabilitation really help with those patients that are facing surgery?
Yeah, thank you for having me on again. So prehabilitation is really doing preparation prior to surgery, the way an athlete would prepare before an event. And so in this study, they did 4 weeks of exercise, nutrition, and decreased stress, which ended up showing that patients had less complications after surgery, and they spent less time in the hospital.
I mean, that's all good news, right? Good outcome. So if someone is interested in participating in a prehabilitation program, is that something they currently have access to here in the United States? And what does insurance coverage look like?
So I would say the first thing you should do is ask your doctor, do you offer prehabilitation programs? If you do, you should definitely enroll and specifically say you want to do it for 4 weeks. If your hospital doesn't offer it, though, you should still ask to maybe get a referral to an outpatient rehab facility where you can undergo a structured program. And if that's not even possible because of insurance issues, you could still do this on your own at home, 3 to 4 times a week, an hour a day, and just increase your protein.
So insurance doesn't necessarily cover. Is that kind of what you're saying?
It all depends on your insurance.
And what could it help with other cancers too? I mean, could it help with any kind of cancer? Because they just studied the one.
Yeah, and so while this study looked at colorectal cancer, there's smaller studies that looked at breast cancer, lung cancer, esophageal cancer. So I think the message is universal, that really we should look at exercise as its own form of medicine.
And for people who maybe cannot get into one of these programs, what are steps or actions they can take to maybe better prepare themselves?
Even just starting with a walk, 45 minutes a day, so a brisk walk is a good way to start. Increasing your protein. In this study, they did 30 grams twice a day of protein supplementation with whey. So just trying to increase your protein intake would be helpful as well.
And real quick, what about after cancer surgery, recovery? What do you suggest?
And there's actually a study that in New England Journal of Medicine that looked at patients after surgery, and they saw that if you exercise regularly, you have less likelihood the cancer will come back and a higher cure rate.
Really good information.